Hi, good morning, everybody. This is Andrew Lau, LoSUT president. I was so glad to got so many people coming in today. Let's see, we have people from Hawaii, and we have people from Los Angeles. We have people from Vancouver, Hong Kong, and quite a bit. And so, and Philippines too now. Some people from Philippines coming in. So I appreciate all the time that you spend to talk with us. One of the reasons why I doing this webinar regarding teeth is kind of interesting. People say, why you talk about teeth? And I found out that diabetes actually forgot about take care of the dental care. That was my concern. And I was surprised a lot of people actually did not realize many diabetic patients really need good dental care. And net result of that, they basically forgot about the dental care because they thought that, well, is this part of this? I know I want to lower my blood sugar. And they really have limited information on dentists. And unfortunately, also in many of the public education, dental care was not discussed. And that is one reason I thought with this webinar, this will be very beneficial to you. So I thought that would be nice to have a webinar to at least give you some idea why we need to talk about dental care. And on top of that, we also have answer any question you folks have. I talked to quite a few dentists, and it's a lot of patients actually visit them who are diabetic or they are pre-diabetic and find out they are diabetic or from pre-diabetic stage and found out from the dentist I'm pre-diabetic. And they said, wow, okay, then I got at with that, they start looking at more on their problem because the dentist first identified to them. So that is actually a very good thing to have in a sense that now you realize the dentist actually give you some hint about your dental problem. And I appreciate, people from Hawaii, my favorite customer, Faye, she's actually a dental hygienist also. And she is really good to actually understand, probably more than I do, but it would be great that she now sharing some thought from us and maybe you can give us some questions, whatever. So I appreciate all the people from Los Angeles, Hawaii, Canada, Philippines, and Hong Kong. They're all coming to participate. Hi, I'm Andrew Lau, LoSUT president. 你好，多謝你各位今日嚟聽我哋講下點解呢個糖尿病同牙有咩分別啊？咁其實咧，同好多美國啦、香港嘅牙科嘅牙醫啦，原來佢好多人咧，其實都唔知自己有糖尿病或者係前健患病嘅，係喺牙方面嘅時候就翻out，哇！原來我係有問題嘅喎。咁喺嗰度先開始咧，就即係見即係嗰啲問題出現咧，先去揾其他嘅醫生。咁呢個係一個好好嘅即係先兆俾你先啦。So this is really a good early finding if you are diabetic and able to at least have someone to say, wow, your teeth has issue. And is it really related to diabetes or you're pre-diabetic? Okay, so this is a very good indication from my dentist friend from Canada, from United States, and also in Hong Kong. They all have the similar situation that brought up. And so that's why I thought it would be nice to talk about dental care in diabetes patient. And that result, you get some insight and tips how to first, what to look at in the dental care issue. Second, how to maintain good oral health. Okay, so I'm going to bring my lectures over. Okay, the key issue is today's topic. We'll talk about tips of pre-diabetic, diabetic works, what to look for in a dental issue, and how to maintain good oral health. That's our today's topic. Now, the thing is this, there's a lot of people that actually have diabetes don't even know. And 80% of the pre-diabetic people actually do not know, maybe found out through general healthcare tests and they say, you're pre-diabetic. Okay, so it is very important to check, okay? So in order to control your diabetes, because diabetes is a lifelong disease, the only way you can do it is you can actually do it is by, by your diet control, you got to do exercise, your weight management, and you have to lower your A1C. And everybody do the same thing. And this is truly a complicated disease if you don't take care. And the complication can be severe. So in order for you to help, you got to get rid of all the white powder food, which is like rice and things like that, juice, soda, that has to be minimized. And certainly drinking low sodium will help because of the fact that it does naturally lower your blood sugar, cholesterol, blood pressure, and detox. 嗱，各位朋友，diabetes 係永遠唔好嘅，所以你一定要 control 控制。點控制咧？就 basic 你要喺 diet 控制啦，喺血糖控制啦，喺 exercise 控制啦，你 weight 控制啦。如果唔係咧，就算你係前期患病嘅3年就轉咗糖尿病者啦。咁所以其實咧係好重要咧，繼續努力去做嘢，一世都係你嘅努力嘅。咁如果同埋仲有一樣嘢咧，你就要所有白粉嘅食物咧，就要全部控制，食少好少，焦晒啲冇得飲啦 ，soda 就唔好飲啦。咁去糖茶係有幫助嘅。And everybody goes through the 4 stages of diabetes, from pre-diabetic to diabetes, they all go through 4 stages. What are that 4 stages? The first stage is usually the LDL will go up. And when LDL go up, what's going to happen is it will damage your insulin comes out. There's a B cell, B cells. That's supposed to take the insulin to the cells, okay? So take the sugar into the cells, take the sugar into the cells. However, when the high LDL cholesterol, it damaged the B cells, and the B cell no longer take sugar into the cell. There are more insulin comes out, but they're never able to get enough sugar in the cells. Your blood sugar will continue to goes up. So this is a sort of catch-22. And then you can get a lot of so-called insulin resistant. Then move to stage 2. Then the high cholesterol and the sugar make your blood become very thick. And when the blood becomes thick, you will start forming plaque throughout the body, brain, kidney, heart, everything. And then your blood pressure will start going out, the stage 2 blood sugar. And that's why you have all these plaques everywhere. And that's why it's so detrimental to your health, because it forms plaques everywhere. Then stage 3 comes, your blood sugar continue goes up, your A1C start going up. What is A1C? Is that hemoglobin, the amount of blood sugar in percentage attached to a hemoglobin. If you're 5.7, you're a normal person. Over 5.7, you're pre-diabetic. And then up to 6.4%, you still are pre-diabetic. If you don't do anything, no control, in 3 years, most likely you will convert to a diabetic. After 6.4 or 6.5, you're diabetic. So you become stage 4 and you become a diabetic. So everybody go through this 4 stage, and that is something that you really gotta watch, okay? 各位朋友，每一個糖尿病病者咧都 go through 4個 stage。第一個 stage 咧就係呢個 LDL cholesterol 上嚟啦，然後就會 damage 個 B cell， 帶啲糖入去你嘅細胞裏邊啦。B cell 嘅胰島素裏面有個 B cell 嘅，咁兩樣高 up 咗之後咧，咁嗰啲糖一路高咯喎，咁你糖加埋嗰個膽固醇嘅。咁你嗰啲血咧就變好結，咁就成身咧嗰啲血管咧塞晒啦，一路係咁塞，一世都係咁塞。咁如果你咩都唔做啦，咁但係咧個問題咧，你個血糖咧有個叫有個血糖紅蛋白咧，嗰個叫 hemoglobin 咧，咁啲糖黐咗落去咧有個 percentage 黐落去嘅。如果你5.7%你普通人冇問題。如果你多 5.7 至 6.4 咧，你係前期患病者；如果你過 6.5 咧，你就糖尿病啦。咁如果你係第3期咧，咁一路慢慢正常，你咩都唔做啦，咩都冇解到啊，咁你嗰啲糖咧就繼續升上去嘅。咁你個血A1C 一路繼續升嘅。咁如果你去到3年後咩都冇咧，咁你就俾糖尿病者，因為你個 A1C 去到 6.5 以上啦。咁呢個4個 stage 咧，個糖尿病都係咁行噶啦。咁所以你要注重。問下醫生每一次去，喂我 A1C 幾多啊 ？You have to ask, okay? And why low sodium work? The reason low sodium work is One, low tea have guava leaves, which has guava leaves has a function delay the sugar absorption into the gut vessels, and then the bitter melon would take what it does is increase the insulin sensitivity, so it take back the sugar into the cells, and then also excess sugar will dump the sugar out the urine, and also dump the cholesterol out the urine, also dump salt out the urine. So at the end of the day, a lot of people who drank low sugar found that one, the blood sugar come down, two, the cholesterol come down, three, the blood pressure also come down, four, they also have detox. So a lot of young people drank that. You know what could happen? The pimple went down, there are no more pimple, they feel better. And on top of that, they saw the cholesterol become better. So that is how low sugar work, and why a lot of people who have high insulin resistance and they drank low sugar tea, it works because it increased the insulin sensitivity, took the sugar back into the cell, and excess sugar dumped it out on the urine. So net result, you get rid of your sugar and get rid of cholesterol, and you get rid of the salt. So people drank it, the swell went down. 嗱，各位朋友，去糖茶好簡單。第一，佢有個番石入邊咧就 delay 咗嗰個糖咧係入去你嗰個大腸血管裏邊，咁少糖入去啦。咁但係苦瓜咧係會一個好嘢咧，就係將啲糖帶入去個血管裏邊嘅時候咧，佢 increase 咗嗰個胰島素嘅敏感度，咁啊帶翻啲糖入去個細胞裏面啦，咁你少咗糖啦。咁但係有啲糖都係喺度嘅時候咧，佢就將個帶啲糖咧喺尿嗰度掉出嚟，個 cholesterol 即係個膽固醇掉埋出嚟。第三，仲有呢個鹽咧都掉咗出嚟。咁當鹽掉咗出嚟咧，血壓 eventually 降低嘅。咁仲有排毒，哇！呢樣嘢係好好嘅，所以變咗飲去糖茶真係好大分別啊！咁好多人飲咗之後冇咗暗瘡嘅原因都解。Now keep that in mind when you have really high blood sugar. It is truly will damage your whole body for the rest of your life continuously. And you cannot reverse it when the blood sugar are so high, damage your vessel, and you might have a chance of a stroke. You might have loss of memory. That's why you have a lot of old folks keep asking, have you eaten dinner yet? Or if you ask you the question every 5 minutes, same question. It's not their fault. Basically, they just don't remember because it's all plugged. And then you have a cataract, you have glaucoma, you know, the eye become blurred, cannot see. I have a young engineer, 40 years old and younger, and he already have that problem. So they can only save one of his eye, other cannot save. It's continually blurred. Sad story. And then you have possible heart attack, and because your blood vessels are plugged. And then you have nerve damage, because the nerve damage is because the sugar are so high, it damages your nerve, so you don't get the feel. And then when you don't get a feel, then you have injury you don't know, and then you might get really infected. You got to end up cut off your foot, amputation. And on top of that, also you have the damage your kidney, and then you end up with dialysis. And then plus, because you always, many diabetes people will have high blood pressure and will damage the kidney, plus at the same time damage the vessels because they're all blocked out. And majority, not majority, 30% of the diabetic patient has no sex function because they cannot feel. So it's really sad, right? 30%. And on top of that, if you have pregnancy, you have chances of complication, which is called gestation complication. So you might be now diabetes, but 5 years from now, you might be now because you have pregnancy. You might get well, but 5 years later, it might come back. So you got to really watch, okay? 嗱，各位同學，你好啊，哇！我糖尿病我咩冇事啊，又冇 silent symptom，又冇咩感覺嘅。咁其實咧，幾年後咧，你就會好大問題啦。咁其實中風啦、眼盲啦，或者你有個白外障睇唔到嘢啦、青光眼啦，呢全部 affect 到你嘅喎。因為我有呢個 engineer 30零歲已經係睇唔到嘢啦，哇！好慘喎嚇，仲有咁多年生活點做嘢啊？咁就係可以有心臟病啦。仲有神經系統損壞啦，咁你冇 feel 喎，係咪？咁仲有血壓高啦，同埋咧又斬咗腳啦， 同埋仲有呢個腎病啦，腎病係一個好大問題嘅，大概啊，即係3個之中有1個人都會有呢樣嘢嘅，所以變咗3個糖尿病者有1個都會有呢個問題，所以變咗係一個好嚴重嘅問題，所以一定要注重。咁同埋咧，30%嘅糖尿病者係冇性生活，因為佢冇感覺啊嘛，佢 nerve damage 咗啲性生活咧。咁仲係咧，如果你懷孕咧，你依家可能已經有糖尿啦，咁你好翻咧，只係唔使 worry 咧，唔係你要繼續注咗，因為可能咧會翻轉頭嘅。So Losudi, what helped us is we have 5 programs. Like today is one of the programs. We have webinar, but we do actually have 5 programs. We teach you about diet. We teach you about how to what type of low carb diet, low fat, and plus we have a lot of write up for you to look at, to learn about Losudi, drinking Losudi to help you lower blood sugar. We'll give you an exercise program, which you can able to lower your blood sugar, and then weight control. So net result, you will be lower your weight and definitely can drive your A1C down. And net result, we hope that will drive your A1C from 10% all the way to 5.7. You'll be a normal person. You might say, hey, maybe not everybody do that. I don't think I can do that. But actually, I have a lot of patients now. They were A1C was 10. Now the A1C is 6 and 5.7. Between that 5.7 and 6, many achieve that, but the area take effort. What kind of effort they do? They actually have strong diet control. They write down what they eat. They also measure their blood sugar every day, 4 times a day. On top of that, they actually exercise, weight control. After they done that, bang, actually the A1C was good. So keep doing it. It works. Actually had prevent the blood sugar continue to be high, and they all below 6.4. They are like pre-diabetic stage. Some went to 5.7, normal person. Okay. 嗱，我哋公司咧有個5個節目program 咧，係幫助嗰啲前期患病者同埋糖尿患病者，將個 A1C 咧由10咧跌到5.7以下嘅。咁其實你話係咪得唔得㗎？我依家有好多病人真係咧係見到佢咧係由10去到6點幾，然後有啲去到5點幾，哇！好開心啊！因為咧佢真係好用功嘅。點解咧？佢喺個食物控制得好啦，有 exercise 啦，有磅重啦，同埋咧仲有即係聽我嘅書啦。今日好多人都聽書啦。咁同埋咧佢真係 check 佢嘅 blood， 每日度血糖4次，知道佢做咗咩都有咩。咁邊樣能夠令到繼續控制嘅 ？So very important, we gotta measure your blood sugar in order to understand where you're at all time. It's not like once a month you do it. No, you have to do it every day. So that way will be good. So today we're now talking about a topic. I caught up already, and I noticed a lot of people now saw what they heard. Now you might say, hey, how come you keep repeating? But one, more repeated, you can more remember, because then you can able to really see that, I'm missing this point, I'm missing that point. So net result, you hope that you continue to formulate a habit. That's what I'm trying to drive at, okay? Now, the reason why I talk about this program, because that's important, because a lot of diabetic patients, they really went to the dentist, do not think that this is diabetes associated with their teeth, with diabetes. And actually, if you're diabetic, you're going to have a lot of actual dental problems like cavities, infection, gum, the bones was weakening, so the teeth becomes loose. And actually, because of that, because you're diabetic, you actually get less blood supply to the oral cavity. So especially if you're 50 and up, your dental risk become much, much higher. So today we hope that will give you an idea. What does that mean? So net result of that, you're going to start understanding, wow, actually, if I'm diabetic, I better pay attention to my teeth, and also look at, is my teeth, the gum infected? Is it red? And is there a lot of plaque around that infect? So all that will be discussed today. I hope that you can able to get a much better idea. Net result, you can prevent many oral disease that can be hamper you down the road。嗱，各位朋友，其實今日咧我哋講嘅嘢咧係好重要嘅。點解咧？因為咧原來好多人都唔知道糖尿病同埋癌有咩分別啊？其實係咪搞錯啊？點解同癌有分別嘅咧？其實唔係，因為好多 dentist 都話俾你聽咧，原來好多病人咧係冇 idea 嘅。咁冇 idea 咧嚟到嘅時候先知道，原來係糖尿病喎，或者係前期患病喎。咁其實咧，原來糖尿病咧有好大問題咧，嗰啲血咧去到口腔嗰度係少咗好多嘅，同埋好易發炎嘅，尤其是50歲以上嗰啲啊。咁個肌肉咧，佢個牙周病咧就有好多出現嘅不同問題出嚟。咁個牙肉同埋嗰個骨咧又係鬆咗啦，會流血啦，有發炎啦，呢嘢全部都係一樣咧係會出現嘅。所以咧今日希望咧俾你多啲了解，咁你有注重咧就快快去睇牙醫啦。OK？ So importantly, today we hope that we alert you folks the typical diabetes dental problem they will face. So that way you can be earlier alerted, and that result you get seek medical help dentist early. Now, first of all, be real. Diabetes have much higher risk of dental problem. You might say, what mean dental problem? Why? Why me? Because you have high blood sugar. And you have high blood sugar that actually you can encourage more bacterial growth and your cavities in your whole mouth over there. And then you're going to have higher chances of gum disease. And that is naturally because you lost sugar there, right? So some of the common symptoms you will see is your gum becomes swollen. Okay, it's kind of reddish. Later I'll show you some picture. It will be red, sore. It might be also bleeding gum. And the teeth become loosened. And then from your, you can actually feel, wow, how come my teeth is losing? So the tooth become loose. And also on top of that, with some bacterial growth, you know what? You're going to have one bad thing, bad breath, okay? And then also because your gum start changing for the infection, for older folks, the denture, it doesn't fit anymore. And you don't have the regular bite. So all those will be affected you if you are diabetic. So that's why I said today, you are highly related if you're diabetic to see a dentist because you have a higher risk if you are diabetic for dental problem. Okay? 嗱，各位同友，好多人問我啦，喂，糖尿病同癌有咩唔妥㗎？其實我都唔會係知道有呢樣嘢嘅喎。咁其實咧，好多牙醫咧，美國都好啦，我哋都讀美國牙醫或者加拿大牙醫或者香港牙醫都傾過幾次嘅。佢話好多糖尿病咧嘅人或者前期患病人咧，佢係唔知道有呢樣嘢嘅。咁當佢嚟到睇牙周病嘅時候，先發覺，咦，我牙周病好嚴重喎。咁然後咧就去睇一睇度埋血咧，哇，原來係糖尿病㗎，或者你係前期患病㗎。咁嗰陣時咧係發現嘅。咁其實你有一個問題就係，喂，點解會有咁㗎？嗱，記住，當你係糖尿病嘅時候，你血糖點啊？高咗上嚟。當你高咗上嚟咧，嗰啲細菌咧就容易 grow， 即係成日增長喺呢個成個牙裏邊嘅成個口腔裏容易增長。咁同埋仲有咧，你個牙周病咧係個發炎率咧係高好多嘅，因為你個糖係高啊嘛。咁多數嘅常見嘅問題咧症狀係咩啊？第一，你係會個金牙，即係嗰個牙肉咧會腫咗嚟，有紅啦，會痛啦，會流血啦，仲有嗰啲牙咧會鬆啦，同埋咧你個牙咧可能甩得出嚟啦，同埋仲有一樣嘢咧係好大問題咧，容易感覺到咧你口腔會好臭啊，口臭啊，因為點解啊？好多 bacteria 喺度咧，喺度生長，咁口一定會臭啦。咁同埋老人家咧，譬如你係60歲咧，咁多數有假牙咧，整啲下就唔 fit 噶咯喎，假牙好似鬆咗咁樣，咁你咬落去嘅時候咧係好辛苦嘅。所以咧，如果你糖尿病患者係有呢啲咁嘅全部出晒嚟嘅， 咁你一定要注視啊，注重啦，就唔好話冇乜所謂啫，唔係冇乜所謂，因為呢個咧，如果牙係發炎咧，令到你係會令到轉變咗其他好大嘅問題出現嘅。Keep in mind, don't misunderstood. Dental care is not serious because a lot of people, because of the dental, the teeth infection and cause serious problem. Don't forget, when you're diabetes, your immunity goes down. And on top of that, if you are especially old and you're diabetes, your infection can cause you to be multiple problems and can go to be so infected that affect your brain or everywhere. So don't misunderstood this. You gotta take good care of any gum disease, the swell, red. Don't let it get worse because you are a diabetic. Keep that in mind. Especially people who are poor diabetic control with high blood sugar, even more so, are so important to look carefully because the chances of gum disease for you are much, much higher. And you definitely have a dry mouth, loose teeth. And on top of that, another thing, you have a fungal infection. Now, fungal infection is so common for diabetic, okay? So you gotta really take good care of that and then make sure that your blood sugar, now, if you have an infection, another problem you come across is your blood sugar will goes up high. The reason your blood sugar go back high is because of the fact that the body is saying, hey, I'm infected. I need to fight. So to make your blood sugar management will be so much more harder. So net result, you don't want your oral cavity to be infected. That is the key, because if you do, your management diabetic will be even more difficult. 嗱，各位朋友，記住，糖尿患病者咧，如果你係嗰啲糖好高嘅話咧，仲有一個好大問題咧，你嗰個牙周病嘅風險一定大嘅，同埋你嘅口腔會乾啦、口臭啦、你牙會甩出嚟啦。有一樣嘢好多人有咧，就係個叫做真菌嘅發炎。當你有真菌發炎咧，你要 take care 嘅，因為如果唔係咧，佢唔會好嘅，一路越大。咁你糖咧發炎咧一路高，你唔想將呢個發炎咧令到你咧係令到全個地方去到其他地方，哇！呢個就更加弊啦。咁你變咗，如果發炎咧，個糖高咗之後咧，你個血糖嘅管理咧係更加困難嘅。嗱，如果真菌咧好多時咧，你要食 antibiotic 叫抗生素嘅，如果唔係話就咁自己會唔會好嘅。同埋仲有一個好煩嘅東西咧，就係 once 你有真菌發炎咧，佢會翻轉頭啊，繼續發炎啊。咁呢個時候好煩，你好咗之後5-6個月後又再嚟過，哇冇弊，所以一定要 take care。Keep that in mind, especially when you have fungal infection in the oral cavity. It will come back. It will keep coming back maybe 5-6 months later. So you got to keep watch because there'll be one red spot, whatever, on the gum area. And maybe you have to find out whether it's a gum infection or fungal infection. If you don't take care of it, it might associate you to other problems. That is the key that we want to prevent. So net result, how are we going to try to manage all this? And I think that is the key here. Now you know the problem you can have. You have gum infection, loose teeth, and all the things that come along. And then in fact, it's hard to manage. So now the thing is, I need to how to understand the problem is there, exists, and I gotta look at it all the time. Is you gotta see a dentist at least 2 times a year, at least, to check out. Because the dentist will basically understand, okay, you gotta tell them that, hey, doctor, I'm a diabetic. And so they will look at you a lot more detail. And then on top of that, dentist or the dental nurse, they make sure clean up your teeth very, very well. And on top of that, the dentist also can tell you how to take care of your gum and your teeth at home, or the dental nurse to tell you how to take care of the teeth gum at home. Because if you don't know how to take care, you might have a lot of issues that come on, which you can prevent, but because you didn't do that, it didn't get prevented. So very important, you got to continue to look at, you know, the you got to every year, don't miss your dental appointment to let the dentist to check on you, and plus you tell the dentist you are diabetes. 嗱，你頭先已經聽咗嗰啲重要嘅問題出現，牙周病、發炎，咁點樣處理咧？咁所以咧，每一個堂友好重要咧，一定每一年咧要睇2次嘅牙醫。咁牙齒佢睇嘅時候咧，佢就一定話俾你，喂，我係糖尿病者嚟喎，咁佢會注重多啲其他人哋唔會睇，佢會繼續睇呢個，因為糖尿病有一辣嘅東西，佢要得點睇嘅，咁佢注重多啲。On top of that，佢同你洗牙都洗得乾淨啲 ，make sure 啲 plaque 走晒啊嗰啲東西啦。咁呢個咧，同埋咧，佢要問埋佢咧，喂，點教我哋啊糖尿病者點去處理我個牙周病嘅問題啦，或者去點去保持我嘅牙嘅健康啦，呢啲咧你要叫個醫生繼續教你，因為咧好多時咧佢教點刷牙、frosting 啊，呢啲係一定佢嘅責任教你嘅，咁 make sure 要做呢樣嘢。Now, first step, you have to keep your plaque to the minimal. You notice all the plaque here? You can see everybody, my mouse. All these plaque are with food, saliva, added together bacteria. The plaque will definitely form, and it continue to damage your teeth. It damage all the teeth in the sense that your gum, all those, and then net result, eventually the plaque will become tartar and form the plaque. It's not clean. Go underneath your gum, and then eventually it will be so difficult to floss. Now, if you don't floss every day, I know a lot of Hong Kong people don't floss, and that's scary because if you don't floss, a lot of the plaque remain there and continue to form bacteria and cause inflammation in the gum, and you get gum disease. Now, if you have high blood sugar all the time, this is going to get worse, and the gum will be swollen. You see the reddish swollen color is swollen. Plus, you have all the plaque over here. And then eventually, if the gum becomes swollen, sometimes the teeth, it become loose, and eventually you lose your teeth. So these are the things that you have to remember. Keep plaques to the minimal. 嗱，有一樣嘢咧，每一個牙齒裏邊咧有好多呢叫做 plaque 啦，咁佢個就呢個叫斑啦，我哋講啲人啦，咁呢啲嘢咧係要用牙線先掹得開嘅。咁呢啲黑色一啲，呢啲黑色或者白色嘅都係呢啲咁叫做 plaques 啊。咁呢啲牙線咧係點掹開咧？就要每日咧你去做呢個牙嘅即係牙線嘅動作啦，將呢啲 plaque 咧去掹走咗佢，同埋刷牙。咁但係好多人咧，我知道香港人咧就好中意牙線嘅，咁呢個唔係一個唔好，真係十分唔好嘅習慣，一定要繼續用牙線咧，係將呢咁嘅 plaques 咧係掹開咗佢。咁同埋咧，如果你唔掹咗佢咧，好多啲 plaques 咧就開始form發炎啊。咁呢發炎咧就會令到你個牙周病咧越整咧就開始，然後越整就越嚴重。尤其是如果你係個血糖高嘅話咧，你牙周病咧可能更加繼續嚴重。咁你睇到呢啲咧，全部呢啲牙嘅 plaques 喺晒度啦，你睇咩啦？咁其實你仲有唔會去用牙線去處理呢啲咧？咁越整越為，同埋你去 dentist 做唔到咧，咁可能個護士咧就要同你洗牙，將呢啲 plaques 咧係去除咗佢嘅。咁如果唔係咧，你個牙就可以腫啦。總之就變咗你個牙掹鬼咗佢啊，因為甩咗出嚟會，呢個係常見嘅啊。So very important, keep the plaque to be minimal, and this is very, very true. That is a daily activities that you do. Frosting, each meal, frosting. After that nighttime frosting, okay? Now, you have to brush your teeth to keep bacteria from making a plaque and lead to infection. So I've put some picture here. You have to brush your teeth inside, outside, upper, lower, everywhere. So you gotta make sure brush it every time you finish. In fact, if finish dinner, at least or lunch, if you can have a chance to brush, it would be good. You do not, at least twice a day. Excuse me. Maybe that means that you have to brush when you wake up and when you go to sleep at least twice a day. But even better, if you can after eat, you brush your teeth even better. On top of that, when you brush your teeth, make sure you brush the tongue and the gum area, because the tongue has a lot of bacteria that harbor there. If you don't brush it away, that tongue might be one bacteria to help you lead to other infections. So that's very important. 嗱，各位同友，因為我糖尿病者咧，最低限度每日刷牙，最緊要刷2次，最好食完飯就刷啦，咁就要每日4次啦。但係我知有陣時出去係難啲嘅，咁如果咁講咧，最低限2次。咁如果刷牙咧，即係好似我喺個圖嗰度啦，裏邊上面出邊後全部要刷晒，要最係刷2分鐘。咁同埋咧，仲有咧，你要刷埋條脷啊，同埋所有啲金嘅地方。咁變咗嚟講咧，希望你咧能夠將呢啲所有嘅 bacteria 都沖走咗先，每日都做呢樣。脷係有好多 bacteria 加上去嘅，如果你唔刷嘅話 ，OK？So make sure you brush your teeth 2 times a day at least. Best if you can go 4, it will be better after each meal. Now, as I mentioned, frosting is so important because frost is control plaques, and then where area of your teeth brush, your toothbrush does not reach, the frosting is to help you reach that. So you have to use frost. Now, I know a lot of Hong Kong people do not use frost, but get a habit, man, because that will help you to prevent a lot of the gum disease. Now, the pictures over here, how you do the frosting, come down, come back up, come down, come back up. So you come back, you take back all the food and also the plaque removed. You see, especially the back of the teeth, that are the very important place. You gotta have plaques. That might have plaques over there. So you gotta have frost to remove that. Now, I have advised a lot of the people, to basically to put a small frosting packs with them, buy from pharmacy. That will be very helpful to carry with you. So after eat, you can frost yourself in the toilet, in the restroom. So that way, at least if you cannot brush your teeth, I know brushing teeth is hard outside when you start working, but definitely you can frost every day. So that way, make it easier to remove your plaque and also all the excess food out all your teeth area, so you get able to frost. So buy a small little frosting pack, put it in your pocket all the time, go anywhere. So you get done your duty frosting every day after eat. 嗱，每日一定要用牙線，牙線係好有幫助，因為刷牙未必刷到好多呢啲咁嘅地方嘅。咁你個牙咧就開始 form 好多 plaque， 白色啊、黑色啊，好多人 form 呢樣啦。咁變咗嚟講，牙線咧線咗呢度咧，你就將呢啲 plaque 咧，呢度可以嚟掹開咗佢，呢度可以掹開咗。咁整咗之後咧 ，guess what？ 你個牙咧就冇晒啲 plaque， 防止咧就咩啊？有啲細菌喺度啦 ，form 喺度啦。咁同埋咧，你刷牙刷唔到嗰啲，你用個牙線就掹咗佢啦。咁買翻呢個細嘅屈臣氏全部都買㗎啦，呢啲買個細裝嘅牙線，食完飯就即刻去，即係好似牙籤一樣，但係呢個唔係用牙籤，依家用牙線，因為呢個仲好牙籤，因為好多地方咧又最後啲牙咧係捉唔到嘅，呢個做到嘅。So very important, continue use your dental floss every day after each meal. That will help you, definitely help you prevent any kind of the plaque forming, and will improve your oral health. Now, another thing that you got to do is every day mouthwash every day. And that is definitely will help you tremendously. You know why? Rinsing your mouth, you are actually get rid of the bacteria. So you always use mouthwash, the antibacterial mouthwash. And that is definitely help you to actually prevent plaques being formed and prevent gum disease. And on top of that is a very nice thing because the whole oral mouth is now fresh. People pass by you and say, wow, you have a nice breath. And you don't get all embarrassed, I have bad breath, okay? Because definitely get rid of debris. Now, one more good thing, every morning or every time you go home, after dinner, you rinse your mouth. Some of the study found that also rinsing mouth are also prevent COVID-19 disease. You know why? Because bacteria might have gotten into your throat, and you rinse the mouth, and the antibacterial mouthwash actually get rid of might be potentially some COVID-19 virus there, and it will kill the virus and throw it out. Now, certainly, you don't want all these things accumulate in here. And studies show that if you mouthwash actually has a additional benefit, prevent COVID-19 infection. Now, definitely, you still need to wear a mask, prevent infection. You can't do that. You gotta have shot. You know, I did 4 shots already, but so mask, shot is a key preventive of COVID-19 infection. But mouthwash will help you additional protection in case you have some contamination. At least you mouthwash and get rid of it, especially when you go to a restaurant to eat. After you finish eating, mouthwash, get one a small bottle, gargle, put back your mask. Now I'm okay again. So make sure you do that. 嗱，每日要用呢個有即係殺細菌嘅mouthwash 咧係好重要嘅。點解咧？因為當你係去啷口啊，啷口咗之後咧，你係將所有微菌都殺咗佢，或者係會當佢降低咗啲微菌啦，同埋仲有咧，你唔會俾佢有個 plaque form 啦，唔好俾個 plaque 出現啦，同埋咧仲有個你可以能夠降低你牙周病啦，同埋你口腔又好清新啦。但係有一個最近嘅 study 好特別，個 study 話咧，如果你食完飯即刻啷口，或者你係翻屋企即刻啷口咧，係幫助你控制。仲有一樣嘢係 COVID-19 嘅 infection。點解咧？因為你冠狀病毒咧，如果你感染咗，你即刻去啷口嘅時候咧，啲菌唔可以種喺你喉嚨裏邊啊，所以快啷咗出嚟嘅時候咧，咁你咪少咗呢個問題啦。所以好重要咧，一食完嘢就即刻啷口係十分重要嘅。So very important. Remember that it prevent your COVID-19 infection is once you eat in a restaurant or anywhere, rinse your mouth right away, put back your mask, you are protected. Now, I know many of us, sorry, I don't have denture, but I noticed a lot of diabetic patients at 60 and up, they tend to have dentures. So your denture has to actually maintain. You cannot just leave it whatever it is, it was fit forever. So that's why you have to go to the dentist to make sure your denture are well fitted. It doesn't cause any irritation to the gum, because irritation causes what? Infection. And you don't want to be in that mode. So maintain that. Make sure a denture is not loose fit. When you bite in, I can't bite because loose, right? And lead to gum infection, and that's not good. And I noticed actually from my own experience, my own relative has actually told me, hey, my gum doesn't fit, and my denture and it doesn't fit anymore. And they thought that was because of age. Yes, that's correct. But the thing is, they kind of didn't realize what to do next step. So I suggested them to go to the dentist to get it fixed, get it fitted again. Then they say, it's really marked improvement because now I can eat and bite. And that's something that you really need to do. So remember that. So denture, the dentist will help you to fix it. And then actually at the same time, your denture has to be clean, has to brush, use a toothbrush and brush. So no net result, there's no bacteria hamper. And then there also a denture solution that you put in there. Make sure you have the cleaning solution to help your denture continue to be clean and be well kept. So that way doesn't cause irritation at the end, no infection. That is the key. Okay. 嗱，假牙咧就要保養嘅，唔係嘛？假都要保養，真㗎。因為點解咧？好多人到老啲嘅時候咧，好多人以為喂假牙唔係好 fit 喎呢幾排，因為牙肉收縮或者有咩問題都係會改變嘅人。當你牙有收縮嘅時候咧，嗱呢樣嘢咧就要個牙醫咧幫佢更改或者係refit。咁呢啲嘢咧全部係要你咧係去揾牙醫去做嘅。咁當你做咗呢樣嘢咧，好似我一個朋友咁，佢話牙唔 fit， 咁我叫 dentist 去搞咗之後，哇！佢話 Andrew 好正啊，因為我依家食翻嘢，有陣時係衰到食唔到嘢嘅，咁所以變咗係唔正仔。咁同埋仲有咧最弊咧，好多時咧呢啲會有真菌發炎，因為你係 irritate 咧，佢真菌會喺度咧，咁發炎咧就弊啦。咁所以變咗嚟講咧，你係要將個牙嘅假牙咧要保養咧，繼續刷牙啦，要擺喺水嗰度浸啦，同埋咧 make sure 咧你唔好俾佢變咗有細菌嘅感染啦。咁就係牙肉嘅感染就有個細菌感染，就係有呢個 fungal infection 真菌感染啦。呢個就唔係正仔。OK。So remember, maintain your denture. Now, also, you cannot smoke. Unfortunately, I gotta tell you that because smoking, like cigars, smoking, or even smokeless tobacco, pipe, cigarette, is all bad for oral health because they form, damage the tissue of the gum. It actually give you tar on the teeth, and on top of that, you end up with bone tissue issue. So all that, especially when you smoke, you gotta face all that problem, especially a diabetic. So net result, I highly suggest you stop smoking for diabetes because if you're diabetic, smoke also increase your blood sugar. So why not to stop smoking overall, improve your oral health and also improve your blood sugar? Isn't that great? Now, I know when we get older, you might have end up to do teeth implant, any kind of dental surgery. You need to advise the dentist to make sure you are diabetic, and you cannot actually have surgery without letting the dentist know, and then your blood sugar goes skyrocket. You didn't let them know that it might be not really good for you. So you really have to make sure your blood sugar are well controlled when you go to your dental surgery. It's not when you are over 100, you have about 180, 190, will not control, or 200, you go sugar, the blood sugar will continue to go even higher. And that result, you have really serious high blood sugar problem. You don't want to do that. So you want to make sure that your blood sugar are well controlled, make sure they in the 120 range, or 6.234 range. So that way, when you go to surgery, you're well managed. Okay. So important when you do like any kind of dental surgery, make sure you check your blood sugar, make sure that it's not very high already or not very low already. Because low, also both high and low have an issue for you. So check that in mind. Now, 各位朋友記住。食煙唔正仔，因為食煙咧會 form 咗好多他喺個牙嗰度咧，咁你要刷啦，刷唔甩咧就繼續令到你會有好多牙嘅周病嘅問題出現啦。同埋食煙咧一定係 increase your blood sugar， 所以唔好食煙啦。咁啊，不如唔好食煙啦，更加好。咁但係你糖友之中咧，多數好多時咧去睇牙醫咧，可能要種牙啦，或者咩嘅牙嘅問題咧， 要做一啲牙嘅小手術啦。咁嗰陣時咧有一個注重咧，就要知道你個糖尿嘅血糖有控制到。如果你糖尿血糖係好高嘅，即係話16啊，或者係200以上咧，咁你就其實要將你糖降低咗，你先好做啦。因為如果唔係咧，你任何嘅 surgery 咧令到糖更加高嘅，咁就弊家伙。或者你係好低咁嘅時候咧，你就去做牙嘅 surgery 咧，可能更加低嘅時候，你暈咗未計唔出奇。所以其實一定要知你血糖幾多，你先好做你個細小嘅牙嘅 surgery。Okay? So keep that in mind when you do dental surgery. Gotta remember, has to measure your blood sugar. Make sure it's not too high. Also make sure not too low. If it's too high, you have to manage it to a manager level, like 120 to 140 range. And then you got to tell your dentist, I have got my blood sugar in this today, so they can see whether it's safe for you to do your dental surgery. Or it's not too low, because too low, you might get fainted and you might really big issue. So keep that in mind. Make sure when you do dental surgery, pre-center, you have to make sure your blood sugars are well controlled. Now, the simple question you might come out and say, well, you're saying all these, how am I going to have good oral health that I can maintain as a diabetic? Now, the answer is very simple. One, you always have to continue to have good diet control, like low carb diet and healthy balanced diet. Make sure you have lots of vegetable, half a plate, all vegetable. 1/4 is what? Protein, which is like fish, lean meat. And then 1 portion is going to be some carbs, that is like brown rice and so forth. But all that together has to be a good diet control, diet all the time. So you'll be always maintain under 150 or no more than 200 carbs per day. So you can plan it that way, okay? What that means is I can do something like 50 to 60 carbs per meal, breakfast, lunch, and dinner. So keep that in mind. No more than 200, or between 200 and 150 carb is your target. Now you have to exercise. What that means, I walk 10,000 steps every day. And I found that, wow, when I did that, I also have better weight control. I lost my weight now from 225 pounds now to 186 pounds. I'm now moving at 186, 188. It took a lot of effort, and about 1 pound per month or so, but that's okay. It slowly comes down. The important thing is, if you have very good weight manager, you basically can able to do 1 to 2 kg per month. Now, I'm not very good at that, but at least I do 1 pound per month. That is good. At least I can do it slowly for the last few years, and I go going down. But you know what? When I start losing my weight, and then my blood sugar, my A1C dropped down to under 6 and between 5.9 and 6. But more important, my average blood sugar also improved, because my average blood sugar is now about 90, 100, and 05. And so on top of that, I found that my knee was better. I don't feel pain anymore when I'm walking. I feel lighter. I feel more energized. I feel more alert. I don't feel tired. And on top of that, one more thing. I also measure my blood sugar all the time after I eat. My blood sugar was like at a range of 120 and below. Wow, that was shocking with just the weight change. There's so many things that come along to change. Well, I actually know about it, but just that you really actually see it for myself, it's very motivating. That's why when you have your Abercrombie, for example, it would be great to keep measuring the Abercrombie to understand what is your weight related to your exercise and also weight change. Keep in mind, BMI has to be 23. BMI will be the ideal BMI you have. Now I'm 26. Used to be 30 and 31 too. Now 26. It's just continue coming down. So I tell you, my client now, a lot of clients get down, beat me. They were already 23 or they are 24. So I said, wow, they're doing so good, but they're serious. They actually take care of themselves with dieting. They actually exercise. Exercise is very simple. They just walk. And a lot of time, if they have a barbell, they do this, and they really works. On top of that, very important, keep in mind, take your diabetic medication. If you have metformin, make sure don't forget pills. One of the things that really important, you have to drink low sugar tea to lower blood sugar, especially some pre-diabetic people. Because pre-diabetic people, they have no medication. So only thing you can drink is low sugar tea to help you to lower your blood sugar, cholesterol, and then your salt, and then in turn, you lower your blood pressure. Because since you have no medication, a herbal item can definitely help you to prevent additional, blood sugar going up or cholesterol going up. And that will be your magic formula. And I'm so happy, a lot of people who are now they're pre-diabetic, they have no medication, but you know what? Their blood sugar are in normal range because they also bought Abbott Levy to measure, 3-4 months to check themselves. I'm so happy with that. Now, certainly you got to stop smoking. And then on top of that, see a dentist 2 times a year to make sure you are maintaining good oral health. OK， 各位朋友，好重要咧，就真係要點控制你個成個口腔健康咧？好簡單，第一 diet control， 即係食物要控制啦，要食啲低碳水化合物同埋健康嘅食糧啦，同埋要做運動啦，同埋控制個磅數啦。其實好簡單，我控制咗磅數咧，由240磅去到依家186、188之間啦。哇 ！A1C 跌咗1 point， 真係跌1 point 啊！依家去到6啦。第二，我一日普通嘅血糖咧 ，average 平均血糖咧喺105啊，或者100之中，哇，好開心。同埋仲有咧，個人係舒服咗、輕咗啲嗰個膝頭哥唔痛啦，行路因為你輕咗啊嘛。咁 on top of that， 你一定要飲去糖茶，因為如果前期患病者咧冇藥食喎，咁你一定飲去糖茶，幫助你咩？降低血糖。呢個係一個好重要嘅，可以講係 secret 嚟嘅，可以講為你做咗一樣嘢咧，你就一定會係好有幫手咧，令到血糖降低。咁仲有咧要唔好食煙啦，同埋仲有咧係能夠你呢個每一年咧睇2次嘅牙醫去管理嘅口腔服務啦。咁飲去糖茶真係會有個效嘅，點解咧？因為去糖茶真係降低血糖啦，降低你膽固醇啦，仲有降低你咩啊血壓啊同排毒。咁所以好多朋友咧，佢係糖尿患病前期患病，一味都糖尿啦，前期患病咧，佢變咗能夠真令到佢嘅血糖咧能夠係一個好好嘅平穩度，係有6之間，即係6.1、2、3、4之間啦，繼續係咁就唔會上去。咁佢嘅 average 咧就永遠都係唔會去到過咗6.4啦，個 A1C 咁啊幾好。咁佢譬如好似 extend 1、2、3年、10年都係前期患病，唔係糖尿患病者，哇！佢第一身體冇咁多損壞，第二咧佢唔會咁快病，好多問題都可以降低咗。同埋仲有一樣嘢好重要啊 ，formulate 咗一個習慣啊！呢個先重要啊，因為你有呢個習慣咧，你一定唔會繼續日日食3個雪糕，你要食好多菜，食好多 protein 嘅東西，呢啲嘢令到你係繼續生活好嘅。I found that one more very important, why I keep driving this, because when you have that, all the diet, you have a control of diet, you start eating lots of vegetable, 1/4 protein, 1/4 carbs, and then you eat the carbs are all high fiber carbs like brown rice and so forth. You formulate a real lifelong habit. Net result, you might be a pre-diabetic or you are converted diabetic to a pre-diabetic. You live maybe 10, 15 years like that. You will no longer be a real active diabetic. Man, imagine the amount of medical expense that you eliminate, and the health issue that you no longer have, man, that will be the major objective we do. Plus, the habit will give you, in case you actually convert back to diabetic, you can convert it back because you have a good habit. The exercise, the weight control that you will continue to lower, and you'll be so motivated to be keeping yourself real healthy. And that habit is a value of health. That's why my patient was telling me, Andrew, you give me a gift of health. And that is really true. That's what they try to do. So you need to start really understand all the early warning signs of your oral issue. The early warning sign, you can see the plaques all around here. If you don't, sometimes you might not even feel the pain or symptom, but you gotta go to see the doctor, right? You have to make sure you have no gum disease. But you will sometimes just find out, wow, my teeth don't have pain, but have some kind of bad breath. And then you start seeing forming plaques everywhere. The gum starts swelling. But at first time, it only swell, doesn't have pain. And some people don't have pain because the nerve damage. Your tooth become loose, your mouth become dry. And then on top of that, you start getting bad breath. You better go back to see a dentist because that will be the early warning sign. So that will be something that you need to always watch.嗱，各位朋友，好重要咧，咩叫警告信號咧？如果糖尿患病者，第一，我哋已經講咗啦，有可能未必有痛啊，有 symptom 嘅，但你一定要繼續去咧見你牙醫，每年見2次。但好多時咧係你開始牙肉咧有些紅腫。話你唔痛喎，個原因因為你 nerve damage， 你唔會痛咁滯啊嘛。咁但係咧，你開始咧好多依咁嘅 plaque form 咗之後咧，咁你知你已經有少少問題嘅喺度，咁你一定要處理嘅。咁同埋咧，就開始咧見到牙肉腫之後咧，開始流血啦，同埋咧亦都覺得牙開鬆啦，個牙肉呢度唔係仲整住啲牙啦。咁同埋仲有咧，你開始咧。就有啲好乾口嘅乾個或者口乾或者有個臭味啦，咁你快脆咧要睇醫生啦，因為醫生咧幫助你咧，同埋牙醫個姑娘咧同你洗乾淨洗牙 ，make sure 你啲 plaque 走咗，咁你先能夠令到你一個身體健康嘅。So in summary, and I do appreciate all the people from Hawaii, Philippines, and coming in to listen, and Hong Kong, and Canada and Los Angeles, because really pre-diabetic diabetic patients, they really don't felt that how oral disease related to dental problem. And if they don't know that, that might be an issue because they might not have the sensitivity to understand if you are diabetic or pre-diabetic, you're going to have dental problem like cavity, infection, gum disease, really you're going to have that, and the bone might be damaged and not holding the teeth. You're going to have that. So you got to make sure do dental check 2 times per year. Make sure, very important, by all means, keep the plaque to be minimum, brushing your teeth, dental floss, each day, each meal, not only each day. After meal, you go dental floss. Mouthwash every time after a meal, or at least once or twice a day. That's very important. And you have to maintain good denture, meaning you have to brush your denture, make sure it's well fitted so you have better bite. And you cannot smoke because smoke can cause plaques everywhere and all kind of issues, increase your blood sugar. If you need to have dental procedure, make sure your blood sugar control, not too high, not too low. So you got to tell the dentist you're diabetic, and you got to have the early oral warning sign of the issue that you might face. Like, for example, pain, swollen, plaques everywhere. You got to know that. Now, in order to maintain good oral health, very simple. You have the good diet control. You have the low carb diet, healthy, balanced diet. make sure that you only have 150 grams of carbs lower or no more than 200. You have to exercise. You have to weight control. You have to take a diabetic medication. More important, you have to drink low sugar tea to lower your blood sugar. And net result of that, you have total good oral health. Doesn't from oral health lead you to other major infection. And that's what we're trying to do here. So thank you very much. 各位朋友，記住，如果你係前期患病者嘅話，同埋你係糖尿患病者嘅話，你真係要注重咧牙嘅問題，因為牙周病咧係會令到你個牙發炎啦，可能令到你咧更加去其他嘅地方嘅大啲嘅問題啊。OK， 第一，你每年最低係睇牙醫生2次。第二，你要所有嘅 plaque 咧，要牙菌斑咧，要令到最少去少 plaque 即係牙菌斑咧，要最少去少。你每日咧係刷最低係2次啊，如果可以刷到4次更加好。但係只要有時唔得嘅，如果唔得嘅話咧，就用呢個 dental floss 牙線啊，食完嘢就去做牙線，然後之後咧冚翻個mask 出翻嚟，咁最低限度咧，你係可能夠將啲牙嘅床嘅東西掹晒走先，咁唔會 form plaque 啦，唔會 infection 啦。咁最好咧喺嗰度一齊做埋咧，買樽細嘅啷口水啷埋口，咁嘅時候咧，咁你更加理想啦。牙嘅嘢掉晒出嚟，啷口嘅時候亦都將好差嘅東西即係走埋出嚟，咁見咗你牙嘅健康更加好啦。咁如果你有假牙嘅話咧，你真係要 maintain 得好啲啦。如果唔係咧，你就有好大問題啦。尤其是跛唔到咧，會 injure 嗰個筋啊，即係個損壞筋啊。咁同埋咧唔好食煙啦，因為食煙係有 form plaque 喺度啦。咁同埋咧就如果你係去到 dental surgery 咧，就一定要記住話俾牙醫聽，我係糖尿病者，如果血糖太高或者太低，你要處理話翻俾佢聽，唔可以俾佢太高嘅。咁同埋咧，你知道晒最多問題，你依家係有咩問題出現咧？好似牙個腫咗啦，金腫咗啦，牙痛啦。當然有陣時都未必有症狀嘅，只係開始有啲紅色嘅東西啦，但係好快就轉壞嘅。所以呢個咧係要注重呢樣嘢嘅。咁最重要咧，其實策略就好簡單，一定係要繼續喺食 low carb diet， 即係低碳水化合物，要食啲多啲菜，一半係菜，1/3係四分一係呢個 protein， 4分一係你嘅即係碳水化合物東西，好似紅米啊啲東西啦，要 exercise， 要 weight control， 咁同埋咧就要食你嘅糖尿病嘅藥啦。如果係糖尿病，如果你係前期患病者，一定飲去糖茶，因為冇藥食嘅。咁冇嘢食咧，一定係靠去糖仔啊，降低血糖。咁所以咧，你最後咧，呢個係好大幫助你咧，能夠令到你身體健康，糖降低，膽固醇降低，血壓降低，同埋咧將佢排毒。咁呢個希望你咧就將你嘅你整個牙嘅問題咧都唔會有發生。So I hope today will give you a very good base information to show you what you have to look for. Importantly, if you have plaques already see on the teeth, make sure you use a dental floss. Take care of it first, brushing the teeth. If you cannot do it, go to a dentist, get it clean, because that will eliminate your future problem. Yes, it's a small investment, but you got to make sure that you can eliminate all the problems that go with it. Thanks, Eugene, for a question. First, could you go over early warning sign again? Okay. So this is the early warning sign that I want to show you this picture. I don't know, this picture is not as good as I want to, but I thought that was a good picture. Examine everything in there. Eugene, can you see the picture? You see all the plaques over here? All the plaques? First of all, when you might have no symptom, where you might not have pain, you might not have anything that you know that You might not bleed yet, but the early sign is the plaques. You notice the plaques are everywhere. You see this white spot here, the brown spot, could you brown, right? These are the things that you every day you can see yourself. Go up the mirror and point it out and say, do I have a lot of plaque? If there's a lot of white, yellow stuff between your teeth, you know you have a lot of plaques. And that has to remove. How do you remove that? You have to have a dental floss to remove. You have to brush your teeth to remove. If you cannot remove already, you need to go to the dentist to remove it because that is so stuck already in there. You don't want this plaque to continue to develop because they will harbor what? Infection. And these infections will cause you problem down the road because your gum is going to be also infected. Eventually, you're going to, now the second stage coming in, you have pain in the gum, you start bleeding, your teeth start losing, your gum cannot hold on the tooth anymore, and the bottom of the teeth as a bone is also weakening. So all that will come. So the early sign, first thing you notice is all the plaques are being there, not bleed yet, the gum is slightly red, eventually become pain. So before you even get that, you need to start taking care of. If it doesn't work, you got to see dentist. So I hope I answer your early sign.嗱，余尊問一個好問題，咁最重要嘅早期嘅口腔警告咩啊？第一，你有冇睇呢張相啊？裏邊咧好多咧呢啲咁嘅 plaque 喺晒度，睇唔睇到啊？你 plaque 喺度嘅時候咧，你一定要用個牙線開始喺度掹開佢啦。但係整唔到點算啊？整唔到咧，你就真係要見牙醫啦，要揾個牙醫或者牙姑娘咧同佢洗牙，洗到佢乾乾淨淨。同埋咧，如果你唔做呢樣嘢 ，next step 咧個牙肉咧就開腫啦，根唔會開腫。牙開腫之後咧就會開始發炎啦、流血啦、隻牙會鬆啦。呢啲係一路咁繼續嚟嘅。呢個 second stage， first stage 就好多 plaques。你睇呢個牙好多 plaque 喎，但係香港人咧，我見到係好多人有呢個 plaques 嘅。個原因就係香港人好少用牙線，同埋刷牙或者刷得少。牙線同刷牙係兩個一齊嘅，一定要做嘢，所以每晚都要做啊。最好就每日食完飯都要做，咁就最好啦。咁我有個表妹咧，日日都做嘅，佢食餐佢就走去廁所做牙線噶啦。哇！佢啲牙好靚，你睇唔到佢有 plaque 喺度，咁變咗係控制好多發炎嘅機會。Okay, so I hope I answer your question, Eugene. So important is first you have to control all these plaques are not being formed, and then make sure the gum don't get infected, don't get red. Because next thing you're going to be pain and it's going to get worse. So I hope I answered all your questions. Are there any questions? Eugene, you always get good questions. I appreciate that. And thank you. All right. Okay. I appreciate you participate your time with us. Thank you again. Have a nice weekend. I hope that this will give you a good idea how to manage your dental issue. Don't ignore it because it is absolutely a critical issue for you as a diabetes or a pre-diabetic. Because a lot of people don't even understand that if they're pre-diabetic and they continue to let it go. And when they are diabetes, the gum disease, a next step, they bang, come out real quick. So you form your habit, frosting, get rid of all the potential infection of your oral issue. Okay? Thank you again. Thank you very much. I appreciate your time. And I really hope this information can hold your hand throughout your diabetic journey to eliminate more healthcare issues that you might face. 多謝各位朋友，多謝你今次咧係繼續聽我嘅講座啦。希望呢啲嘢咧係令到你咧更加了解，哇！原來糖尿病係百多嘢東西要注重嘅。咁有咗佢嘅時候咧，就令到你咧更加係了解咧，就唔會因為牙周病咧係令會更加大嘅問題發生。咁呢個係好特別嘅。咁我希望你嗱，下個禮拜咧，我係會去咗外國，去咗美國，其實就冇咗書聽。我下一次要聽書咧係要6月4號先有啊。 咁變咗嚟講啦，就係希望各位再繼續會聽書啦。咁下個禮拜係冇堂上嘅，冇呢個webinar。咁下6月4號意見你啦。So Eugene and all the good friends like Gordon and Wason, next week on the or actually this week on the 28th, there'll be next week on the 28th. Sorry, next week on the 28th, there will be no webinar because I will be traveling. I will be in a flight. Will be unfortunately cannot be in giving you guys webinar. So the next webinar will be June 4th. Okay. So take care, and I'll see you folks. And the people from Hawaii, I hope I can see you guys in next week sometime. Take care, friends. Bye.